your question. Right. So if you have read and understood, considering it critical care scenario, kindly tell me, how would you manage this patient?
I will manage the patient according to ATLS protocol.
Okay.
I will first check the airway if as there is soot in the nostrils of the
Yes.
patient, and there may be airway burn. In that case, I will check the airway pattern or not, and simultaneously I will go for resuscitation. And I will
Airway burn
after
can lead to what kind of complication which obstructs the airway? Laryngeal edema.
inhalation injury.
Yes, okay.
And if I suspect inhalation injury, early intubation should be done
Okay.
even before laryngeal edema develops. And then I will go for checking breathing and ventilation. In case of inhalation injury, there may be ventilation difficulty.
Yes.
And I will check the saturation of the patient, and then I will do the chest examination. And if there is circumferential chest burn or
Yes.
burn in the trunk,
Okay.
it may also cause further difficulty in ventilation.
Okay. Can
And I
you,
will address that.
yes. Can you
Yes,
please
ma'am.
tell me who would you involve in the management of this patient and where would you manage this patient?
Can you, sorry, ma'am?
Who would you involve in the management of this patient and where would you take care of this patient?
I will take care of this patient in a specialized center where all the facilities
Burn
is
center?
present to take care of
Burns.
burn
Okay.
patients, and with an ICU facility.
Can you tell me the criteria to admit the patient in the burn unit?
Yes, ma'am. In case of full thickness burn, more than 5%. In case of partial thickness burn, more than 15%. In case of child, in case of adult, and more than 10% in case of child. And any kind of chemical burn, any kind of inhalation injury, any kind of circumferential limb burn, or any kind of circumferential constricting burn. If there is any facial burn or perineal special burn of the special area like hand or perineum, and
Considering
burn is
the
other comorbidities.
considering
Yes.
the burns of this patient, can you tell me how would you calculate how much area of burn this patient has acquired or has suffered from?
Yes, ma'am. We can calculate burn area according to Wallace rule of 9 or
Okay.
London chart. In this case, apparently, if I calculate through the Wallace rule of 9 formula, this may be 35 to 36%.
Okay. Can you also tell me how would you take care of the nutritional status of this patient?
I will take care of the nutritional status by giving enteral feeding And in case of more than 20% burn for adult and more than 15% for children, I will give I will give extra feeding by nasogastric tube. And there are some formulas to calculate the nutrition requirement, like a Curry formula is there.
Okay.
For adult. Yes, ma'am. Should I mention the formula?
No, that's all right. All right. Can you tell me, if you fail to manage this patient, what are the complications that these burns can lead to or can happen if you don't manage this patient on time?
What should be what is the sequelae of this patient, burn patient?
Yes, you can tell me. Like, if you don't get to manage the patient on time, what are the complications
Okay,
of the burn?
this may lead to burn shock, inhalation injury, sequelae of inhalation injury, and there may be it may develop into AKI. Sepsis may develop, and if there's
AKI is
circumferential burn injury, it may be
acute kidney
compartmental.
injury. So instead of saying
Yes, ma'am.
abbreviations, kindly say the whole thing, so it will give good impression. Okay, can you tell me what is, all right, can you tell me how would you determine the depth or the extent of the burn? What are the factors that you look for to determine the...
Ma'am, I cannot hear you properly.
Okay, I'm asking, how would you determine the extent and the depth of the patient? Can you hear now?
Ma'am, there is interruptions. I cannot hear the full sentence
Okay,
as you're
I'll try again.
asking.
If you can tell me the extent and the depth of the burn, how would you determine that?
Okay, how to determine the extent and depth?
Yes.
And there it may be partial thickness, it may be full thickness, and partial thickness may be divided into superficial partial thickness and deep partial thickness. Partial thickness, superficial partial thickness is first degree burn, second degree is the deep partial thickness, and full thickness burn is third degree burn.
Okay.
And I can assess the depth of the burn by inspection. It will in case of partial thickness burn, it will be red or reddish or pale color, and there will be blister and it will be painful. And in case of full thickness burn, it will be white leathery, and it will be insensate.
During during burn injury or during the injuries of the burn, how would it affect the lung compliance?
Sorry, ma'am, I didn't hear the question.
Yes, during the burn injury, how would it affect the lung compliance?
In case of inhalation injury, how? Okay. In case of inhalation injury, there is extensive capillary alveolar capillary damage, and that causes leakage of protein-rich fluid into the interstitial space, and neutrophil migration, leading to widespread release of cytokines that causes alveolar basement membrane damage, and fluid enters into air spaces, causes stiffening of lung tissue and ventilation perfusion mismatch. That's how in acute phase it causes ventilation impairment.
It decreases the lung compliance as well. Okay, good. Can you please help me and read this? Can you please read this X-ray? Which view is this?
Sorry, ma'am.
Which view is it? Is it PA view or AP view?
This is AP view, maybe.
Okay. Can you explain what you see? Can you read it to me, please?
This is a chest X-ray AP view showing.
Which view do they do normally? Do they do PA view or the AP view?
Normally, in case of trauma patients, APView is done,
Okay.
and in case of burn patients or inhalation injury, as we do portable X-rays, PAV cannot be done usually.
Yes. So what are you looking at?
There are uh, diffuse pulmonary infiltrates involving both lung pills,
Yes.
mm, and, and postophrenic cardiophrenic angles are not
Obliterated.
obliterated.
Yeah. They're obliterated. They are not visible.
Okay, ma'am. Yeah. They are obliterated.
Yeah,
Postophrenic and
because
cardiophrenic angles are
both. Yeah.
obliterated,
What about the cardiac
and
shadow?
the cardiac shadow is enlarged in size, and tracheal
Can you
position is
can you see
normal.
okay, it's not deviated. And what
No,
about these
not
infiltrations? What does that signify?
that may be uh, mm, features of ARDS.
Okay. Yes. What else do
And there are
you
some
do?
other possibilities like fluid overload, pulmonary edema.
Yes. Yes. Okay. Do you see gas under the diaphragm? Yes.
Yes, yes, ma'am. Yes.
Yeah, that can be changed. Okay. Any fractures? No. Any other
Bony
deformity?
thorax is normal.
Yes.
No, no other bone deformity.
Basically, when I will request you to go back and read the way how x-rays should be read. It's just A, B, C, and D, and then you have to come back and tell me what all these A, B, C, D, E signifies. Okay, we'll
Okay,
discuss
ma'am.
that tomorrow. This is
Okay, ma'am.
homework for tomorrow. So, good.
Okay.
Thank you.